Hey everybody, welcome back to another wonderful AHA Live Connection show. I am one of your hosts, Nita Miller, a speech pathologist, and I'm joined by my lovely co-host, Kate Scotty.
Hi everyone, it's so good to be back. And
we
have
are
an exciting show for you today. We're so excited to have this topic all about therapy, which it's so funny. This is our third episode, right, Nita?
It is.
And as therapists, how weird that we haven't done a show on therapy quite yet, but we do have a really awesome group of ladies today to talk about therapy from the perspective of an OT, a PT, and an SLP. It's going to be a great day.
Yeah. Before we jump right into it, though, we do have a couple of announcements. So the first one is I just want to remind all of our members about an exciting new benefit that AHA is offering. So if you are a current AHA member, don't forget that you receive $175 off of a MedBridge CEU membership. And the way to access that is to go to the American Hippotherapy Association.org. You're going to log in under the member account. You're going to click on member benefits, and there will be a link there to the MedBridge site. And it should log you in where you can then utilize that discount. So definitely don't forget to do that because that is a great asset to have as an AHA member. The other really exciting update we want to give you guys is that next Saturday, June 26th at 1 o'clock Mountain Standard Time, we are hosting another international networking event. So if you joined us during the conference, you may have heard of us talking about this, or you may have joined, but we held an international networking event with, I believe we had 14 different people from 14 different countries. If that's something you're interested in, please reach out to us. We can send you the link. You can reach out to the AHA office. I believe the link was also going to be posted on the Facebook page, but that should be something that's going to be really interesting as well. So that's all I have to say, Kate. Do you want to jump right in and introduce our...
Yeah, I think let's do it. Let's do it. So I'm going to start by introducing Karen Gardner. I'm so excited and honored to be bringing Karen into the conversation. So Karen is the owner of Silver Lining Therapy, LLC in Texas. It's an occupational therapy clinic that includes hippotherapy. She's an AHA faculty member, hippotherapy clinical specialist, PATH International Master Instructor, and driving instructor. Karen is the secretary of the Texas Board of Occupational Therapy Examiners, which is the state licensing board for OTs in her state. And she is an adjunct professor for the OTA program at Lone Star College. Karen is certified in natural lifemanship, trauma-focused equine-assisted psychotherapy, which is also known as TFEAP. In addition to hippotherapy, her treatment specialties include sensory integration, aquatics, DIR floor time, and NDT. She presents at local, state, and national conferences on a variety of topics within OT, hippotherapy, adaptive riding, and horse training. She utilizes a variety of natural horsemanship techniques in her horse training and therapy sessions. Karen is a past president and former board member, that was a tongue twister, of the American Hippotherapy Association, Inc. And I am so excited to introduce her to all of you. Karen, welcome.
So thank you, Katie. I appreciate it. I'm really glad to be here. And it said, kind of tell you where I'm from. I'm from a tiny town in Texas called Brenham, between Houston and Austin. And like I said, I'm thrilled to be here. This has been fun.
Well, we're so thrilled to have you with us here today. Now I'm going to introduce Miss Sunny Holmes. Sunny is the Director of Therapy Services at Ride On, an organization with 2 locations in Southern California, where I would love to be right now, offering both therapy services and adaptive riding lessons. She is an AHCP certified therapist and PATH International registered therapist, as well as a member of the AHA and the American Physical Therapy Association. Sunny has been a regular guest lecturer for the DPT program at Western University of Health Sciences and is an APTA clinical instructor. Sunny has a passion for educating patients and families about the importance of integrating functional activities with treatment sessions. She believes that the incorporation of equine movement during a therapy session is one of many tools which allow patients to reach their full potential. And Sunny, we are so excited to have you here today to talk about treating in a natural environment. Welcome.
Hi guys, thanks for having me. I'm really excited to talk about this topic today.
Awesome.
So I am pleased to introduce our last but certainly not least individual, and that is Miss Tina Rocco. Tina is the Director of Speech Language Pathology in Motion, located in Long Island, New York. She opened it in 2011 to pursue her dream of helping children and families by combining her two passions, speech language pathology and animals. She enjoys working with toddlers and preschool aged clients with speech and language delays and disorders, and children of all ages with complex communication challenges. Tina believes that communication is a basic human right and presumes competence in all of her clients. She focuses on strength-based, client-led approaches and believes strongly in developmental and relationship-based interventions over cognitive or behavioral-based methods. Tina is a proponent of the neurodiversity movement and strives to bring empathy and respect to all of her sessions as well as into the community. Tina is experienced in PROMPT, DIR floor time, the SOS approach to feeding, and AAC. She's a graduate of the ASHA Leadership Development Program. She's won numerous awards, including the AHA Barbara Glasgow Therapist of the Year Award. She is an AHA past president, and she currently serves as a committee member on the AHA Ethics and Advocacy and Reimbursement Committee. So welcome, Tina.
Hi, everyone. I'm very happy to be here and looking forward to talking with all of you about this topic.
Awesome. We are so excited to have you all here with us.
Yes, and I'm very glad to be the host because I'd be very intimidated to be a guest with any of you. So I'm so excited for our viewers today because all of you submitted really amazing and beautiful pictures of the facilities where you work, your clinics, and I'd love to kick our conversation off talking a little bit about the clinics where you incorporate hippotherapy, how it's set up, what the space is like, any locations and treatment areas you utilize. I want to hear about it all. So Karen, would you mind kicking us off?
No, I'd be glad to talk about it. I am currently set up with a small building that's my clinic located on my farm, but I use spaces like I have my barn, I have access to where we bathe the horses, I have the arena. We use a lot. It's been a small amount of time, short amount of time as possible inside the clinic. The way my clinic is set up, it's kind of divided in half. It's a single building. This is a one therapist clinic. And one end is all fine motor, educational readiness, tabletop activities, and the other is more of a gymnasium, sensory-based kind of gymnasium with, it has a treadmill, it has a elliptical, a bicycle, the wiggle machine, which is a vibratory plate, a total gym in it, all very, because the place is small. But we try to be set up to do what we need to do in the clinic and also engaged in what's happening outside. And that goes along with this striking the natural balance, trying to use nature and incorporate what's happening outside.
Yeah, I would absolutely
Did you have any
agree.
other questions about the clinic?
No, I mean, I love hearing about how you incorporate the clinic and outside. I mean, that's really why we asked you to participate today. And I know Tina and Sunny, you both have clinics and incorporate a lot of time outside into your sessions. Am I correct?
Yes, absolutely. Would you like to hear a little bit about our setup?
Oh my gosh, of course.
Okay, so
Yep.
We have two locations at Speech and Motion. So one is a clinic space in a professional building, which is very much like your traditional therapy clinic. We have 3 treatment rooms and a waiting room. And then our other location is a 13-acre horse farm. So the picture on the screen now is our Hop Hog location. So this is our sensory gym. We actually on the other side of this room, you can't really see it in this picture, we have a chalk wall that's also magnetic. We have a therapy swing. We have a ball pit in this room. We also have another treatment room that's much smaller and just has room for some suspended equipment and a treatment table. And then we have a larger speech therapy room that we utilize for play-based therapy. We have a lot of room to do play on the floor. And then our other facility is a 13-acre facility that has a variety of spaces that we use. So we do have an indoor space, which you're seeing right now, our covered barn. This is our indoor arena that's on the screen now. We also have a classroom space here that we utilize. The property also has trails and paths and a lot of different places we could utilize nature. We have an in-ground pool. We have an adaptive playground. So we have a lot of different unique things we could utilize at our facility.
It is a great place, not just based on your description, Tina, but it is a great place to work, if I do say so myself.
It's
alert. I work for Tina at Speech and Motion, so.
Yes, I'm very lucky to have Kate there. It's wonderful to have her. But our facility, one thing I will share, we do have a track that goes around the perimeter, so we could actually utilize equine movement and have the horses bring us to one of those other spaces that we utilize. It's a nice setup.
Oh yeah, it is awesome. Absolutely awesome. Sunny, can you tell us a little bit about your facility?
Yeah, absolutely. So we have 2 locations in Southern California. One's in Chatsworth and one's in Thousand Oaks. So the photos that they'll be bringing up today are from our Chatsworth location. And we're about 45 minutes from LA. And so in our Chatsworth location, we have this clinic space here. We have some suspended swings. We have a partial weight-bearing treadmill system. We've got therapy balls and every kind of, toy imaginable in there. And then we also utilize up near the barn, similar to Tina, we utilize the barn aisle. We also have a trail that kind of goes behind the barn with some man-made little mountains and valleys, as I call them. So a little bit of a challenging trail for some of the patients. But yeah, we utilize the barn aisle, and then we also have a set of stairs that we utilize and a bleacher area.
Oh wow, it sounds beautiful and amazing. So I guess what would be good to transition to at this point is really to talk about how you take advantage of those environments and how they benefit your clients, right? Because what we're really here to talk about today is treating in a natural environment. And it sounds to me like everybody kind of has a clinic that they treat in, but they also have another space that's very different than their clinic. So how is treatment different in those 2 spaces, if it's different at all?
Yeah, so I'll just kind of jump in with one little caveat. In the past year with COVID, we have really tried to utilize more of our outdoor space rather than using a lot more treatment inside the clinic just for, social distancing purposes and for, outdoor versus indoor. So I think if anything in the past year, we have utilized our outdoor space even more and made us a little bit more creative in that outdoor space. So like I said, we kind of have the barn aisle. So sometimes I'll do galloping down the barn aisle. We might use the horse in front of us. Yeah, use some horses for motivation, for single and balance. We have, like I mentioned earlier, we've got a set of stairs, so work on stair negotiation outdoors. Just some examples of kind of how we use our environment there. We've got, some nice horse motivation in the background from Wiley, and a little bit distracting too. So that's another component that it adds to rather than the indoor clinic environment. So Yeah, that's what it,
Sunny, I'm glad you brought up COVID because that was actually something we had to adapt to also. Really, in New York, when things got really bad, we chose to not utilize equine movement at all because it required our treatment team to all be within 6 feet of each other for an extended period of time. So we really, so we really had to shift how we were doing things too and get really creative with using, our outdoor environment without making our whole team work within close contact. So we really were maximizing that too for a while without using equine movement at all.
And Tina, we did the same thing with, often it would be myself, my client, and maybe one of the ponies. And we would just work without the team, and it may be just standing and doing some hand activities or leading, or it just engaging with the horse present while we're doing another task, but not having the whole team there. So we made a lot of adaptations during COVID times. So glad that's mostly over.
Yes.
Oh yeah, definitely. I think we all feel that way.
So one of the things I have that I utilize a lot is, like I said, I'm at my home. So I've used my garage, I've used my shop, I've used my closet.
Oh my gosh, I love that.
I know. So, well, vacuuming can be occupational therapy activity. I
wish you'd send us a picture of your closet, Karen. I'd love to share that with everybody.
Well, so I do utilize that, but always the horses. I mean, the horses on my property are family, and so they're accessible, and it's not all just coming and riding in an arena, being on using the horse in the arena. So I try to use as much of my natural environment as possible. And natural to me is not just being outdoors. It has been, it's been a while, but I've done cooking at my greater clinic, which is the max, the whole farm here. But trying to do natural activities that occur in a more natural environment.
Yeah, that's a really good point, because I think that when we named this this event in particular, I was thinking about natural as being out in nature, but that's a really excellent point. And I mean, I think for all of us as therapists, one of our goals is for things to be as close to natural as possible, because that's going to make generalization a lot easier for our clients.
But isn't that the challenge of being a therapist, is to think, oh, well, I have this person who needs to work on whatever that is, that task. And how can we create that in a clinical, in an effective way, to see something that's really meaningful to in their natural environment? It's a challenge.
Yeah, definitely. And I think too, just the nature of therapy, there is a contrived part of it, right? There's something that we have to address a specific goal. We're supporting something specific. So we're going to try to contrive a situation to create that opportunity. But the way that you're describing things, Karen, you're really getting it as close to real world situation as possible. Right?
Trying. That's my challenge. Yes.
Yeah. It sounds like they're doing it. Tina and Sunny, do you ever have an experience like that? I mean, I know, maybe as an SLP, I don't know what I would do in a kitchen necessarily, unless I was doing feeding therapy, right? But while I was working on language goals, especially because the population I work with is primarily pediatric. But Tina, there was a pretty awesome photo that you sent in of a snow day, it looked like.
Yes.
Oh, yeah.
Yeah. So, well, to kind of piggyback on what Karen was just saying, it's when we teach skills in a variety of really meaningful ways and meaningful contexts, and they're fun for the kids, they learn them better. So I love that we have all of these different opportunities to work on the same skill. So this little girl works on saying go on her horse, but she also worked on saying go in the sled this day, and it was really meaningful and fun for her to do this. And this little girl was working on giving directions about where the sled needed to go because she didn't have the right shoes on to walk through snow. So she had to tell me how to get to the hearts that we had to find. And, what a functional skill, though, to be able to give somebody else directions and instruction. And she, this was so meaningful and fun for her without it feeling like, it was work. It was fun for her.
How fun.
Yeah. I can't imagine that not being fun. It was probably fun for you too.
It was a lot of fun. Yeah, I got to wear snow pants this year.
Oh my gosh. Sunny, does this bring up any memories for you of therapy where you really tried to make it feel natural and as close as possible to every day so it's easy to generalize?
Well, I won't say we have any snow in Southern California, but
for you,
I'm just looking at some of those photos. But definitely, I mean, so, for instance, I think just a couple weeks ago, I was working on, gait training with one of my kiddos, and we were actually using the trail that's mostly meant for the horses to walk on, but I was having my kiddo walk on them up and down, and it's quite a quick transition again between those mountains and valleys, as I call them. And so just working on those postural reactions and just a quick challenge between, having to turn on their trunk extensors, trunk flexors, and that's something that comes up all the time in our environment, whether it's an unsteady sidewalk that they're walking up or down, a ramp in a parking lot. So just kind of utilizing, even something as simple as a dirt trail and seeing it translate into more real world type activities.
Yeah. Oh, I think taking advantage of the variety of the terrain, I think is huge. When you're in the clinic and the floor is nice and level and there's no bumps or declines or inclines, that's one way. But when you get out just walking across the surface, the natural surface in the arena can be challenging. Yeah, that's great.
Yeah, sometimes we'll just, after some equine movement, then we'll go back in the arena and maybe we're working on ball skills and kicking a soccer ball in the arena with all the unevenness, or even sometimes out on the trail that doesn't get, dragged by the tractor, 3 to 4 times a week. Even that can be just a slight difference from the arena. So yeah, just kind of realizing all that. I mean, we are mostly pediatrics as well. And, a kiddo's main job is to play. And so I find that, generalizing their play to other environments can be really beneficial for them.
Yeah,
it definitely sounds like it, because how often do kids really play in a clinic setting outside of a clinic, right? Usually they're playing outside. And that ball example really, I don't know, it really hit home with me, because I'm thinking about, well, if I practice kicking a ball in a clinic where the ground is the same everywhere, and then my family decides to sign me up for soccer, the ground is not the same everywhere on a soccer field.
Right. And your parents probably don't let you kick a soccer ball in the house where it's level.
Yeah, that's really true. So, even though we do have some cool parents.
Yeah. Maybe some parents, but not all parents.
For sure.
So I kind of want to,
it's making me think when you talk about the surface where you're in the arena, is one of the things we do is we'll use the objects like Tina's picture where they had cones or poles or even barrels, and we'll have the clients move them. So, you can always turn a barrel on its side and roll it around, or roll the kid over a barrel and bring them down, or pick up a cone and put it somewhere else. You can, have them engaged in kind of doing a setup of how things are, or at least using the materials that are out there in the arena. It can always be moved somewhere else. So
let's talk about that a little bit, because that's kind of one of the, it's a nice segue into a term that I know a lot of people use, and it was brought up during the initial discussion of, what are we going to do for our next live? And we actually had some people reach out to us and request, well, we'd really like to know more about what therapists are doing off the horse after they've incorporated equine movement. How are they taking advantage of their equine environment? And I want to kind of open up some dialogue about that term, because I think across just us here, we have some very different and really insightful viewpoints. And I really liked even just the discussion that we've had in private, listening to everybody's kind of opinion on it. So I'm going to call out Karen first on your kind of viewpoint on that term, equine environment. Tell us a little bit about how you view that term.
Well, I do think I live in my home is in an equine environment. I'm surrounded by pastures and have horses all around, and a barn, and so I have a farm environment or an equine environment, and I'm always kind of challenged by looking at the environment that my clients are functioning in. They may be at my clinic, but where they need to work on their deficits or the impairments are at school or at work, or and they're in a different environment. So I have to kind of relate how that environment that I have here with my home and my horses can apply to the environment of work, for example, because I do adults and pediatric. So I have a range of ages to work with. And so I always think of it more as context, what context they're functioning in, rather than necessarily the environment. My context would be outdoors, nature, could be an arena, could be a barn, could be the closet, could be the clinic.
That closet again.
I just think of it a little bit differently than an equine environment. Anybody else have a comment about that?
Oh, come on. Somebody has an opinion.
It looks like Nita's talking, but muted.
I can't hear. Yeah.
Can you hear me now?
Yes.
Yeah.
Technology. I was just saying, I really liked Karen's comment, your comment about context versus environment. I think you said that earlier when we were chatting offline, and I've never thought about it that way, but I love it. I love that viewpoint of it's a context.
Yeah, I like that too. And I don't know what really just got my wheels turning about when we speak with other treatment professionals who don't use this environment, who don't use this context. It feels, I think there's this like novel aspect of it that feels very unique and special. And even just so far in the conversation, I mean, if any of our viewers have been with us since the conversation started about half an hour ago, you can hear how smooth the transition is between talk about a clinical space, an indoor space, to an outdoor space where there may or may not be animals. So we're really doing the same thing across the environments. And I think the way we talk about it is really important because it isn't magic. And while it's special in some way and it's unique in some way, it's not different at all. And in a way, it's not special, right?
It's so special, but also everything we do inside, we could also do outside. So
Right.
like at our facility, we use the same therapy swings inside as we do outside. I think in my own mind, kind of going back to the discussion on the term, I tend to define the clinic in my mind as the indoor space, just in my head. But when I talk about the rest of the property, I tend to call it our facility. I don't generally say equine environment because our facility does have so many things like a pool and a playground and trails and paths. So it is a place where horses live, but there's also so many other things. We're really just outside and utilizing the natural environment, or I guess our outdoor clinic space, works too. But yeah, I kind of have to think about that one a little bit more. But I would say it's our outdoor facility or our clinic, our outdoor clinic.
Yeah, Tina, I really like that you just termed that phrase, the outdoor clinic space. I think that I'll take that home and use that one now. Because when Nita first kind of posed this term of equine environment, I kind of thought to myself, like, I don't think I've ever described it that way, but I guess I just haven't described, typically I just say like our facility, similar to you, Tina. And then I just kind of, if I'm talking to a parent, then it might be, down at the building or something. Our building and our barn are a little bit separated by about 100-foot pathway or so. So it might be me then referring, okay, well, we'll meet up at the barn today for therapy rather than we'll meet inside the building, and start in the clinic or such. But I really like the outdoor clinic environment.
I think it probably also has to do with the way that your facilities are set up, because so I've been to Ride On and I've seen the way that Sunny, your guys' facility is set up. Unfortunately, I haven't gotten to make it to your facility at Tina. It's on my to-do list. So I'm coming up to New York at some point. But I know where I work at Skyline, everything's under one roof. So we have we have 3 clinic rooms, and we've got a motor room, and we've got the arena, but it's all indoors, kind of in one building under one roof. And so in my viewpoint, that is the clinical environment, but I definitely could see where if they were more separated, where the indoor clinic was further away from the outdoor clinic, or there was more of a delineation between the two, it would definitely, my viewpoint in my head would be differently. So I think, and it's probably different from, I know therapists who operate out of places where unfortunately they don't have a indoor clinic space, if you will. And so they are having to take advantage of the arena and any aspects around it and the trails and the woodland areas, and their viewpoints are probably going to be different too. So I think we all kind of base it a little bit off of our own experiences.
Yeah, definitely. I would say
Right.
Tina and I probably have the greatest difference between our indoor and outdoor clinic spaces of everybody in the conversation, from what it sounds like to me. We have about 3 exits on the Long Island Expressway. But it works. It works.
Yes. Well, we do have indoor spaces available on the other property too. So
yes,
we do.
Sure.
But yes, our where we would do evaluations and things like that tends to be in the other location that's in a professional building.
Mm-hmm.
Tina, I'm so happy you brought up evaluations, because that's kind of what I wanted to transition the conversation to next. So, while we're able to pick our goals based on what we're seeing our clients' needs are, based on their vulnerabilities and their strengths and what they're showing us, when we do an evaluation, there are some pretty specific requirements for testing, for developing goals, So in these different kind of outdoor treatment spaces, which is, I think, how I'm going to refer to it for the remainder of this conversation, in these outdoor treatment spaces, how do you do things like test and, pre and post test even within a session?
I think from the testing component, it's a little bit more challenging. So obviously you want to create a similar environment to create, similar objective measures pre and post. And same thing when you're doing an evaluation versus a progress report, right? You want to simulate the same environment so that there's no other, coexisting factors that could be contributing to maybe a decrease in standardized assessment score or something like that. Maybe the first time you did it inside your, clinic room, and then the second time you go out and you do it in your outdoor treatment environment. I love that now. And so obviously you might get some different results. So I think that we try to stick to one versus the other. So if we're going to do an evaluation and a progress report, and, then we'll do it either in the clinic and continue it in that setting, or we'll do it in the outdoor environment and continue it in that setting to kind of decrease the amount of variables that we're changing. And so sometimes, to recreate that, I've kind of put saddle pads on the ground in the barn aisle to have some floor mats or, something like that, cover it with a towel. So, I can work on some floor to stand transitions, but not necessarily scrape up any knees or get the clothes really dirty during, an eval, progress report, whatever it may be. That I really need to look at that skill, but just adapting a little bit.
Yeah, that totally makes sense.
So,
and it sounds like you're very creative.
Yeah, and it sounds like, so, and I do the same in trying to do my initial eval. It's very clear that they will not be on the horse when they first come, and sometimes it takes two times to do the initial eval, and I do that in my clinic. That's where I have my testing equipment, and so I make that pretty standard. They do get to meet a horse at the end, but we don't do, until the eval is pretty much complete, I don't do anything that has to do with the being on horseback or anything. That's a second portion of my eval. I do my standard evals first, and then I look at whether or not it should be appropriate to include the horse in some way. So
that sounds very familiar to me.
And I do. Oh yeah, and I do have some clients who don't actually get on horseback. That's my main thing, is to use the equine movement. But I have a couple of clients in which I'm just having the horse present, as Sunny said earlier, as a motivator. Really kind of a behavior management situation with this one boy.
So I have an interesting observation to share. So the first year that Speech in Motion was open, we didn't have a clinic space that was indoors in a building. And what I had found was actually some of my clients, when I did get them into that more traditional space, presented very, very differently than they did when we were outdoors around the animals.
That's true. Yeah.
Yeah. And I actually had an experience with a client that I remember was just so profound and really led me into embracing and understanding the need for hippotherapy to just be one part of a larger total plan of care, because this little girl was in shutdown and she was not talking because she was just overloaded sensory wise, and she presented as a nonverbal child, and I got her inside and she was very verbal. So it was just such an important lesson for us to remember that, when we're doing assessment, we really need to make sure we're doing it in a way that's going to give us a good picture and in a controlled environment.
I'm going to jump off that because these are all such great points. And I had kind of the opposite, if you will. And I've actually had this happen a couple of times. I'm curious if Kate and Tina, if you guys have ever had this experience. But so where I work, we also, we always try to, as much as possible, conduct our standardized assessment, standardized evaluation. There's been a couple of instances where I've had kiddos where in, the quiet, closed off therapy room with minimal distractors, nothing else going on around them, I may give a language test or a language processing test, and their scores come out pretty average, pretty well. And then I go and I put them in a more naturally chaotic environment. So I'll put them on the horse, and there is a huge breakdown. So I get this picture of, this child has these skills, but can't use them in the everyday world because they can't manage the chaos. They can't, their processing breaks down because they can't integrate the visual and the auditory, and this is happening over here. And so I like to do a combination. I like to do my whatever assessment I can in a clinic space where the horse is not involved, and then I like to do a lot of dynamic and clinical observation on the horse, because I get a whole other level of information to incorporate.
Yes.
Yeah, it's a really good point. I think any family that I've ever worked with has probably heard me say that testing is the most unnatural thing that you can do. Because, I mean, usually we're sitting at a table And how often, I mean, I just had a conversation about this today. How often do we sit at a table across from someone and talk to them with nothing in front of us other than a job interview, which what's more uncomfortable than that? What is worse than that? Right? We never do that. And
Yeah.
I think in a testing situation, that's what we're asking our clients to do. And Nita, I really like your point of incorporating both the unnatural and natural environment because it gives you a whole picture, right?
Yeah. I think that's what makes this so powerful when you have that combination, because you can see where the breakdowns are. Like, I definitely have clients who do better when they're on the horse receiving equine movement. I have clients who do better when they're on our playground. I have clients who do better when they're sitting at a table, and I could see where the breakdowns are and where they need to work on making the skill stronger. I have a child who can speak with me really well in his one-to-one session, but you send him to a birthday party and he can't talk to anybody. So, like understanding all of that, I think is so helpful. And we get such a good picture by being able to utilize all these different environments that we have access to.
Definitely. And Kate, that's so funny that you brought that up about, the job interview type testing environment. I think one benefit, I guess, of being in the physical therapy field is a lot of my standardized tests involve movement and involve play. And, just when I was doing an eval last night, we were kicking a ball, and that's part of the standardized assessment, or walking backwards. So thankfully, sometimes I don't have to, simulate a job interview. I could totally imagine how that would be, extremely intimidating for some of our patients.
Definitely. It definitely is.
Or to even put them on the spot. I've had patients where I'm doing a standardized assessment. It might be movement based or, some sort of coordination task, but it's like, okay, now do this, now perform, this task. And then it could either be a complete shutdown or, they could just sail through it.
Yeah.
Well, and it makes me, from listening to Tina and listening to Sunny, makes me think about how I try to think about when to use equine movement. Does someone need it to get started? Do they need to do some preparatory exercise or activity and then have equine movement and then do a functional task? So I kind of think of the input of the movement as a dose of something. Do they need 10 minutes or 20 minutes or 3 minutes twice? And so that's the constant challenge is, figuring out how to kind of optimize how a person is going to function and what that looks like. And, talking about, like I said, what Tina and Sunny were talking about, that's all from that. And it's a challenge. It works amazingly, but it needs to be used effectively.
Yeah.
So Karen, I want to build on that. So you provided us with some really cool pictures, and I want to pick your brain about them a little bit because when I was going through them and uploading them, and you had provided me with descriptions to go with them, what I loved the most about them was not only their functionality, how they captured the functionality and the transference or generalization, but the simplicity behind them. One of my favorites, so I'm going to bring it up here, is this one, and I'm gonna have you talk about it here in a second. But as we go through these, I just loved how you're taking advantage of the unique aspects or items that we have access to because we use horses. And you're not necessarily having to be fancy or super creative. They're so basic, but they're so pure and functional. And I think sometimes people try to get almost like too creative. So tell us a little bit about these.
So this is the situation with a woman who has had a very, very mild stroke and some depression that's gone along with that. And she wants to get back to stop living with her parents and living on her own. And there's just some things that she wants to work at. She has was a horse person before she came to the clinic, and she does help get the horses ready for another client at another time. And so this was just an activity to help her be a little safe moving around in her environment. So we gave her the challenge of taking one of the horses out and doing the obstacle course. And she was working on that. And there were a couple of tasks that we had that she did in the clinic. One of them is loading groceries into her. She did some organizational things that were in the clinic, so some objects on a shelf. And so just trying to gauge, now this is one where she is having to give directions to someone, and then someone's having to follow with that. So she is figuring out what she needs to say, kind of getting that thought process, that clarity of what she needs to translate to describe the activities that she needs to do. So we had her do several of those.
Karen, I have to say, I loved those two pictures, one after the other. The first one of, well, I'm just gonna pull them up. This first one, immediately followed by this one. It really beautifully shows how this really the transference of the skill to everyday life, supporting our clients in generalizing skills to a functional environment. And it's something that it's so visible in those two images. What spectacular pictures.
Well, that's very simple. So this is, a set where someone's buckling a halter, and they practice that, and then they can put it on the horse, because that's a functional task within the context that we're working in. Leads to exactly having to do some self-dressing or buckling a belt. So just how that might be buckling a girth. It might be, buckling the dog collar. Maybe they're going to take their dog out. This again is following a set of directions on how to fasten a girth. So listening, processing, and then performing that task. So this is just an example of that. This is a series of grooming activities where there's so many different tools you can use for grooming that create different types of grasp. I probably have, 12 or 15 different kinds of brushes, and you can do all kinds of things with this. Luckily for me, the horse's hair does not grow in a straight line. It grows sideways, it grows up and down, it grows a little bit whirly here and there. And so following the visual target is part of that. Creating the grasp is part of that. It's to a grasp, so as being able to open a lever door handle to get into the restroom. And just kind of thinking about how a person would be able to function in their typical environment at home too.
I mean, I just like how amazing.
It's simple. I know.
It's so simple,
Yeah.
and it makes so much sense. But I mean, just seeing the pictures and hearing you talk about it, it's just a beautiful explanation of how the skills translate. And I guess I'm nerding out a little bit as a therapist, seeing the skills translate so beautifully from an activity that, and what I love the most about it, I mean, I always say the best therapy doesn't feel like therapy, right? So all of those things are functional. The clients are accomplishing things during all of those activities. It's not just a series of events to complete, to complete the activity, to end the task. They have achieved something through all of those activities that you just did.
So Sunny, I'm going to pick on you now. We've got a couple here for you. So I'm just going to pull up some photos here and have you kind of, well, we've seen that one. Have you talk about them a little bit?
Yeah, absolutely. So I won't say I'm as creative as Karen in some of our outdoor treatment settings. And so I tend to do some of the things that I would typically do in your indoor clinic setting, and I just kind of move them on outside. And sometimes the horse can be a wonderful motivator. So we've got Sprinkles here, the horse cheering on my patient who's showing her his single limb stance. And we've kind of been working on different levels of distraction with him actually while balancing, which is very common for all of us in the real world, right? We're not just in a clinic environment shut off from the world. We're going to have to, walk, step over a curb, balance on one leg for, a short amount of time while moving through the world. So we kind of try to recreate that here where he's distracted by the horse who's moving around in her stall at the same time. So he's not staring at a stationary object. He's staring at a dynamic object, which is in turn throwing him off balance. And then we work on things like where he'll touch his head and his hips, head and hips. So some, distal mobility while having that proximal trunk stability. And we just stare at a horse. But he thinks Sprinkles is cheering him on. And here, I'm just galloping kind of through the barn aisle. Coordination is something that he struggles with. And so we're just, again, in turn, working on those coordination skills. And obviously galloping from a therapy's perspective, I think transfers quite nicely into the barn aisle. Why not use galloping when we're surrounded by horses? And so it's just another motivating factor for him with that one. And this is one of my patients, and we're actually working on Bulgarian split squats. So she has some difficulty with her gluteal weakness, and so I'm just using the rails from the stalls and a little mounting block to get some glute and quad activation. Yet we're not in a clinic environment where it's 3 sets of 10 and you're staring at a wall. She's got Ace is right there again cheering her on, interested in what in the world is she doing. And so it just brings another light to our treatment sessions.
Yeah, when I do split squats like that, I don't have a horse to look at. I'm usually looking at the wall of the gym. It's not very motivating for me.
No, it's not. I would love to look at anything else if I'm doing any sort of leg workout rather than myself doing a workout.
Definitely. And it's probably nice too. I mean, do you ever have your clients talk to the horses during those activities?
Oh, definitely. I'm like, okay, let's show Sprinkles our flamingo, and then he's like, hey, Sprinkles, look over here, look at my flamingo, and just another, added component of distraction, which is all about the real world.
Yeah, and it's so true. I mean, when I am doing things to strengthen my own body, right? Having great music on or having a great partner, having some sort of distraction always makes a huge difference for me. And it makes everything go so much faster because it doesn't feel like work. And I mean, even in those images, you can see how much joy there is in the interaction. And I think that definitely contributes to positive outcomes just on its own.
Definitely.
So Tina, you're up. We're going to go through some of your images now, and we'd love to hear a little bit about them.
Okay. So this picture, the child in the photo was working on articulation, and he was working on the k sound. And we had pictures that had that sound in them. So he would say the name on the picture and then show it to the horse, and then he could put it on the horse's neck. So we're practicing that sound when we put them on his neck. And at the end, the horse got a snack. So we got to practice that. And, sometimes the horse shook his head and the pictures fell and we did them again. But he thought it was funny and it gave us an extra opportunity for more practice. So it was just, again, kind of going back to that motivation of the horse being part of it. And, instead of just sitting at a table going through a list of words, this made it a really fun way to practice these sounds for him.
Yeah, and as SLPs, I'm sure Nita jump in. It can be so monotonous for kids to work on our tick, the same sound, the same word. And I really liked that example of the horse shaking the words off and having to put them back. So natural. Nobody wants to redo a task after you finish folding all the laundry, you pick up the basket and it all falls. Yes, that's frustrating, but how much more frustrating would it be if somebody threw that piece of laundry on the floor every single time you folded it? It would feel very different.
Well, and Tina, so I have to tell you, so we at our clinic, we've been using articulation notebooks. So we've just been getting composition notebooks, and for our tick and phonology kids will print out so many target words that week, and we've been trying to do like fun little thematic type glue-ins. And then what we've been doing is the following session, while the child's on the horse, they have the articulation notebook in front of them. They review their words from the previous week that we glued in. And then after the equine movement portion, we glue in, their target words for that week. And after seeing this photo, I showed it to my SLP colleagues that I work with, and we were like, oh my gosh, this will be great. Let's take Tina's idea, and we're going to now, there are tick words that they're going to have to glue in for this week are going to be, either clipped or Velcroed or somehow attached to the horse's mane. So we can also for our kids that are getting PT and OT co-treats, we're going to make it a, fine motor task. And so we're totally stealing your idea and building off of it.
Oh, fun.
We do have some more fun and creative pictures. So.
Okay, so this is a scavenger hunt activity we did in the fall. It was kind of targeting fall vocabulary, and this is actually while we were using equine movement, but also we could use this while we were walking with one of our miniature horses or while we were just walking around our property. So what we did was we hid those plastic apples around the facility, and the kids had to find them. We worked on prepositions. This one was in a hole. Sometimes they were under things, on things, next to things. So we're able to kind of target all of those spatial concepts. And then target the vocabulary. And for kids, we kind of used the same activity for a variety of goals. So kids who are working on harder language skills maybe had to answer a WH question or ask a question of someone else about what they found in the apple, which is a natural way to use the facility and kind of incorporate our horses. This little girl utilizes an eye gaze system. So this system is really hard to use when we're on a horse, but using it to tell a little horse where to go or what to do is super motivating and fun. So she was practicing asking the horse to do different things using her AAC system. She was helping to hold on to the rope and bring the horse around the property. She was super motivated by this activity. I think we pulled this one up earlier, but I'll add to this. This is one of the indoor spaces we could use, but I actually love walking clients through the barn because it gives us an opportunity to work on greeting and bidding farewell. And I have a lot of clients who need to work on doing that. And when we're in your traditional clinic space, sitting at a table with just me and the child, there's really only one opportunity to say hi and bye. Where when we're walking through a barn, we can greet every animal on our way out to the rest of the facility. We could also talk about which stalls are empty and full. We could work on questions as we're walking through. We could talk about if we're going to walk in the middle of the aisle. There's so many different opportunities for language in the barn aisle.
I love that example of greeting and bidding farewell because, it's a hard skill because you are put on the spot when someone says hi to you. You are, and you have so much time to say hi back before that person moves on. And we can contrive situations to greet and bid farewell. And, I'll read Brown Bear and we'll say hi to every animal, but those animals don't say hi back to us. I can pretend they do and do a really great impression of a duck, but it's a gift. But it's not really happening. And in that setting, especially when I loved how the horse was sticking their head out the stall door, that is a present, and I don't know. I just loved that example.
Yeah. And it's so awkward when you're sitting with just one-on-one and like, say hi to me. Like you can't really prompt that skill. It's a hard skill to teach one-to-one. So this is just a much more natural way to work on it.
Definitely.
This photo is here. I know it's a little bit of an odd photo, but when I give you the context. So because we do a lot of child-led treatment, this little guy had started his session on the horse, and about, I want to say maybe 4 minutes in, he decided, nope, we're not doing that. We're going to get off of the horse. And I honored that. I allowed him to get off of the horse. He communicated that he wanted to build an obstacle course and he wanted to have a race. It ended up being one of his best sessions, that we just let him take the lead and initiate what he wanted to do. He ended up building this whole little path here, and then his sidewalker there, he was super motivated to race him back and forth, and the horse was cheering them on. He was so related and engaged. It was really just such a wonderful, natural session that he kind of just took the lead on, and it ended up being amazing. So that's kind of what's happening here in this picture.
I love that.
This is us using our wash stall to give animals a bath. So here's another space at a lot of equine facilities, I guess, that could be utilized in treatment. So this is a great activity to work on animal vocabulary, answering questions, following directions. It's something that was super motivating and fun, and it's definitely a better activity to do outdoors than indoors, so everything doesn't get soaked. This is our outdoor wash stall space, but we set up a water wall here. So this was another just opportunity for language and interaction that we had set up when it was really hot in the summer months. So this is just another nice thing. Like, we could request reoccurrence, talk about empty and full, wet and dry, talk about the different colors and actions and things that are happening.
And then Tina, we have some pictures here that are very specific to our clinic. You have to talk about this space.
Sure. Yeah. So I realize probably a lot of people don't have a playground, and we're very fortunate that we have this beautiful adaptive playground space. But our playground actually was intentionally set up to look like nature. So you see what we're sitting on looks like a log, and I'm sure that many of you have access to real logs at your facilities and could recreate some of this. But this little girl had utilized a period of equine movement, and then we had transitioned to this space, and we were working on vocabulary and being able to identify who a community helper was based on a description was the skill here. So, and the pictures were hidden all around the playground space. So we were finding them out here and talking about them. But this could definitely be done in really any outdoor space, but we're super fortunate that we have access to this space.
Yeah, and just looking at
Tina,
it.
can I ask you a question about her?
Sure.
Can I ask? So she did equine movement first before she went to the playground?
Yes. Yeah. So the way our facility is set up, when right now with COVID, we're meeting clients at the car, and they transition from the car to where our ramp area is. We transition onto the horse, and then we have a perimeter track that goes around the property. It takes about 8 minutes to walk around that path if you don't stop at all. So sometimes we'll just utilize that 8-minute period of equine movement, and then we transition to that playground space. Sometimes we'll make a loop and we'll use equine movement a little bit longer, and then we utilize the playground. We definitely have some clients who start on the playground and then utilize equine movement second. It just really depends on what works best.
I have to say, I really love the playground, because I think for a lot of our clients, it could be a very intimidating place, depending on what their motor vulnerabilities are, depending on what their sensory vulnerabilities are, and what their communicative vulnerabilities are, because there can often be a lot of people at a playground, and the space itself is different. Sorry, Karen?
You don't know how, the kids don't know how to start to play. When there's a lot of other kids around, they'll just stand there. They don't know how to start.
And I just really love that space. It's so special. It's so special. And then I just have a couple more pictures from Tina, so I want to make sure we get through all of them.
I did share a lot of pictures, so if you have to skip some, I won't be offended. So this picture I included because I really wanted to talk about feeding therapy and the tie-in to feeding therapy and how we could utilize interactions with animals and kind of tie it to food. So if we were working on introducing a new food and getting a child to hopefully eventually eat that food, we might want to start with having the child prepare the food for someone else and really take off the pressure of them feeling like they have to eat it, and really more just having some exposure to it, some experience with the food, learning about the food, watching some of their favorite animals and how they eat the food, and kind of really talking about that. We could also talk about, like, specifically in this picture, there's carrots, but like some, like our bunnies and our horses like crunchy carrots, but sometimes people eat crunchy carrots and sometimes they eat soft carrots. So we can really kind of help to get them to learn about the different properties of food and how it feels. And I think it's just a nice opportunity to expose kids to different textures and foods without necessarily pressuring them into needing to taste them or eat them. It's really just to interact with the food. And then we can definitely carry that over into our indoor space.
I love that you bring up the feeding therapy because as an SOP, I don't specialize in feeding therapy, but one of my colleagues does. And I know one of the things that we've done in the past, because we do a lot of co-treating with OTs as well, is we have had activities where kids had to make horse treats. For the kids. And so it was a great off the horse activity because language wise, you know, if the kid also had some language needs, or if we could group them with another kiddo, there was a lot of, you know, sequencing, talking about sequencing, giving directions, anything grammar based, even articulation, and working together, executive functions. I mean, I'm sure you can imagine the way that we could take advantage of that activity but then transition it to feeding, you know, once the treats were ready and able to be given to the horse. So yeah, I love that idea.
And then the last two pictures.
Well, and I do work with food also, but I use it for hand function. So we prepare food. It might be horse treats. I've done some cooking, but I use granola, peanut butter, and shredded carrots, and they can get in the kitchen and chop some things and use a shredder and make some little horse treats. So we use it as a functional task also.
I love that. Really, really spectacular. And then Tina, you just had two more pictures that you sent in. So
this picture is here. It's super cute, but also the reason why this picture is here is because this little guy, this was actually his class stuffed animal. And the homework assignment was to take the stuffed animal home for the weekend and talk about all the different things that you did with the animal for the weekend. And I just love the idea about this unique treatment, outdoor and indoor treatment environment, the setting that we treat in, that it really lends itself well to kids talking about their therapy sessions and what happened so much more than when they sit at a table. Like he was so excited to go back and tell his class about the horse and what the monkey did that day. And, you know, it's just such a nice opportunity to like carry over and engage in conversation about things. And the latch. Okay. So, and this is here just because we have latches everywhere, which I'm sure all of you guys do. And we have a lot of different kind of latches, but this is just one example. A lot of kids can't figure out how to open this the first time. So this is really just in here just to talk about how it creates a natural opportunity for asking for help. And this is actually a great way. Karen, feel free to jump in, but I'm sure this is a great way to target fine motor goals too. All these latches and gates and doors that we have.
It's kids that can't figure that one out. Adults can't figure that one out either. So I
think I had we got them.
Model how to get help. Right. No. Yeah. We have several latches around here on purpose. I have a wide variety of latches. Yeah.
We do too. Yeah.
I know just looking at the picture of that latch when you send it in, I don't know that I'd be able to figure it out.
It's supposed to be very easy. So you lift up the hook and then the gate is supposed to open and close easily. Like you just push and it goes in and then you just let go of the hook and it's locked. But the gate has to be really level to slide into their well. So sometimes it doesn't quite line up.
Well, I just have one more question before we wrap up. But I've just been thinking about all of you are very active members of the American Hippotherapy Association. And while the AHA is an educational organization that teaches people how to use equine movement as part of a functional plan, as part of a plan of care, I'm curious how AHA and AHA's best practice guidelines and statements have helped you in blending the two, blending equine movement as a tool in with all of these other tools that you use in treatment.
So I'll just briefly kind of talk on that.
Go ahead.
Thanks, Karen. Since I've been a licensed physical therapist, I have worked at Ride On. So I've always incorporated equine movement into my physical therapy practice as one treatment tool. And so a point in time, I was kind of working side by side at another clinic as well. But, at Ride On specifically, incorporating that equine movement as one treatment tool has kind of just been ingrained in me, I guess, from the get-go. So I haven't really known to just incorporate equine movement as a sole treatment tool since I've been practicing. So I think, the AHA best practice about, incorporating a multitude of treatment tools has kind of just been how I've done it from the get-go. I guess I just don't know any different.
Well, one of the things I wanted to point out is I'm on the state licensing board here in Texas for occupational therapy. And so professionalism, what our scope of practice is, what our standards are, is very important to me. And I think the AHA best practice is that link that kind of takes our unique context and makes us focus on professionalism in very specific areas. For example, like safety or training or working with a team, all the different parts of best practice. So I think it's essential for the therapist to understand best practice for themselves and think about how they're working. And I also think it lends itself to a discussion of all the therapists that work at a center. How does that best practice apply across the board for different therapists? And so I just think it's that kind of a fundamental piece that connects us up with our little unique context and our absolute standard for our therapies that we're providing.
Yeah, I think that was a beautiful way to put that into words. Really, it makes so much sense, and I like how you tied in what you said about the board, and it definitely, I think AHA gives us all a really good understanding of professionalism, like you said.
Mm-hmm.
Yeah, just because we're walking into a barn that morning doesn't mean that we should lose any aspect of our, educational background, or Sunny, I know that this came up in a discussion that we had, off the air, in that sometimes even our parents of our kiddos, forget, just because they're driving their kid to a barn setting doesn't mean that, it's raining. Oh, we're going to cancel therapy today. Or I actually had a client's mom call me once and try to cancel because her daughter had a severe sunburn and she didn't feel like, she'd be able to tolerate riding the horse that day. And I had to remind her, first of all, the equine movement piece isn't guaranteed every session, and B, we can still do speech therapy with a sunburn. So she needs to come to therapy. And she kind of had this moment of like, oh yeah, I guess that's right. Okay, well, we'll still come. And
Absolutely.
I'm sure a lot of people that are listening have had some sort of experience of that, of, just because the equine movement piece is one of the pieces that we use, we're therapists first, and regardless of what the weather may be or your severity of your sunburn, doesn't mean that we can't still provide the services that, we're providing.
Oh, definitely. Even just this past week, it was 104 degrees on Tuesday. So with that being said, we did a nice transition indoors for the entirety of the treatment session. And, it's really just, that's kind of my soapbox that I get on, I think, with some families is, that your child is, primarily pediatrics, but, the patient is still receiving physical therapy no matter what, and I wouldn't be doing them a good service by just using one, treatment tool throughout my whole treatment session. I wouldn't want, like myself, if I was getting physical therapy, I wouldn't go to a clinic and they put me on a treadmill for 45 minutes. I'd be like, yeah, that was a great session, So yes, utilizing equine movement is a little bit more dynamic than a treadmill and a little bit more encompassing of, a few things. But at the same time, I think it's just crucial for everyone to remember that they're still receiving physical therapy, occupational therapy, speech therapy. And we still are therapists first, like you were saying, Nita. And I didn't just forget all my skills just because it's raining or it's windy or it's 104 degrees outside. Like,
104 degrees, I might lose.
The rain was a little foggy.
Might not be my best day, maybe.
Agreed. But yeah, we were able to successfully move inside, and that kind of even provided a little bit more of an educational opportunity for me to talk to the parents about, well, this is what, you're coming and we're coming inside, and that's fine. It's actually really beneficial for me to be able to look at all of these skills inside the clinic in one session, rather than utilizing equine movement that day or even up at the barn aisle because it's so hot outside. So, just another educational piece, and it's just an ongoing conversation with parents that I find.
Yeah, it's such a great point. And I do have to like throw it back to AHA because I feel like right from the beginning, as soon as you start learning about using hippotherapy and using equine movement, AHA makes a really big point to tell you that this is just a tool that's used in treatment. It's not a treatment. It's not standalone. It is not something that you use all the time. I mean, I think I have to credit AHA. I mean, I love the American Hippotherapy Association, obviously, but I think it's something that the faculty of AHA does a really good job educating the people who come to the courses on using it as a dosage, like Karen talked about today, who also happens to be faculty. So that's probably why she said it so nicely.
So kind of just echoing what everyone else just said, it really is, AHA tells us in the best practice guidelines that it is best practice to have hippotherapy just be one part of your total treatment plan. And, even just looking at all the pictures and listening to all the discussion tonight, we're really doing our clients a disservice if we don't incorporate all of these other opportunities and if we don't see how they're performing in other, tasks and environments and settings. So I just, I really think it's such an important thing that we remember. I love hippotherapy. I think it's a wonderful dynamic treatment tool, but I think we have to remember that it's not the only thing we should be doing for the whole session. And, I think for therapists, depending on what your setup is like, you may have to be really creative, but there's so many things that we can do, even just being outside, gathering sticks, braiding grass together. There's just so many things that we could do that don't necessarily need us to get on a horse. And, some of the pictures that I had showed too, were just looking at those animal interactions too, and the motivation of just having an animal there to watch or to be a part of the session without necessarily utilizing equine movement. I think it's great for us to really maximize all of those opportunities.
Yeah. So make sure you ask for a session off of the horse, everybody. Parents, clients, families, ask for a session off just in the natural environment. I hope we made it sound like fun today because it really is for us and for our clients, I would say. All right. Well, I guess it's time to wrap it up. Wouldn't you say, Nita?
I think so. I think we've covered it.
Awesome. Well, thank you all so much for participating today. We were so excited to have all three of you, and you definitely did not disappoint. It was a great conversation.
Thank you.
Thank you.
Thank you. It was fun.
And viewers, thank you for coming.
Yeah, be sure to keep tuning into your emails and the Facebook posts to see when our next AHA Live will be. We'll keep you guys updated on that. And until then, stay connected.